There are people of different cultures and backgrounds that are at increased risk for health disparities. In particular, the LGBTQ or the lesbian, gay, bisexual, transgender, and queer population are at increased risk for human immunodeficiency virus and acquired immunodeficiency syndrome. In this presentation, education will be provided on prevention, the importance of equal treatment by the medical staff, along with statistical data on the disease in the United States. More and more people are becoming open about their preferences. It's not just the older generation, but the youth as well. By the LGBTQ plus population being at increased risk for HIV and AIDS, it's important that they are properly educated. Knowing that there is no known cure for HIV and AIDS, other ailments such as mental illness can occur. One may become ashamed, withdrawn, depressed, or even suicidal. It's important that they know that just because they tested positive, it's not the end of the world. They can still lead a long and healthy life. There have been patients that felt that since they tested positive for the disease, that absolutely no one will want to be in a relationship with them. There have been families that have felt that since their loved one tested positive, that they can't be hugged or touched even. That could cause the patients of those families to feel isolated and unsupported. The number of affected adults in the United States alone is well over 1 million. In a particular year, 14% of the people that were tested didn't even know that they had been affected. The rate for males in the same year was 5 times higher than the rate for females. Gay, bisexual, and other men that have sex with men accounted for 69% of the new HIV cases in the United States. That population is the population that is affected the most. 2% of the new HIV cases for that same year were transgender. There is no known cure for HIV and AIDS. That is why it is so important that education and more awareness is brought about HIV and AIDS. Abstinence is the best way to prevent the spread of disease. However, everyone knows that it's hard to abstain. Therefore, it's important to know about testing prior to engaging in physical relationships, about condom use during sexual intercourse. And for males that have sex with other males, it's important to know about pre exposure prophylaxis, or also known as PrEP. PrEP is a tool that doesn't provide protection against all sexually transmitted diseases, but it has proven to reduce the risk of infection of HIV from men that have sex with other men. It has been reported that members of the LGBTQ plus community have experienced discrimination when experiencing health care. Having discriminated against them have caused negative outcomes, including mortality. Back in the 1980s, nurses and nursing organizations made it clear that they were against discrimination against people with HIV and AIDS. More specifically, the American Nurses Associations required nurses to give culturally congruent care to the LGBTQ plus population. Nurses must also advocate on their behalf. Discrimination based on preferences is completely condemned by the American Nurses Association. It is important to advocate on the behalf of the LGBTQ plus community with HIV and AIDS. Everyone deserves medical treatment. Everyone should be treated equally. They all are human. They have feelings as well. In an effort to keep the number of HIV and AIDS positive patients from climbing, there should be more educational classes. In addition, there should be more support groups for those that have tested positive so that they don't feel alone. They have someone else to lean on that's experiencing the same things that they are. being different can cause people to be treated terribly. Admitting that one is a member of the LGBTQ plus community is one of the hardest things that some people have ever had to do. On top of that, being a member of that particular community and also having to admit that you're positive for HIV or AIDS is even harder. People shouldn't have to hide or be made feel ashamed of who they are. It's important that the medical professionals provide equal treatment, advocate on the behalf of this community, make patients feel comfortable talking about their conditions and how they're feeling. Professionals should take the time to talk to these patients and provide education in a manner that they understand. They should be taught that it's not okay to even force their beliefs onto others. It's not always known what a person is feeling mentally. Just because people are smiling on the outside doesn't mean that they're smiling on the inside. And it only takes a little to push a person over the edge. However, it takes one person just to show kindness and empathy towards someone. And that one person could possibly save somebody's life.